So, good morning, everyone. My name is Alexandra Olson. I am a project officer at the European Health Management Association, or EMA for short, and I will be the moderator for today's workshop. On behalf of the DTRIP4H project consortium, I would like to welcome you to our workshop series, which aims to gather user needs and expectations to shape the development and deployment of a trustworthy and effective decentralized digital twin environment. Before we get started, I would just like to note a few aspects related to housekeeping. First of all, this workshop will be recorded for the purposes of transcription as well as communication and dissemination. So if this is something that you are not comfortable with, please feel free to leave your camera off. Secondly, this is an interactive workshop, and we invite you to share your comments and thoughts using the chat function. After the interventions from our panelists, there will be a dedicated period where you can ask them questions, and someone from EMA where you can ask questions and someone from the EMA team can ensure that your questions are directed to the appropriate panelist if it has not already been addressed. Thirdly, if you have any technical issues, please reach out in the chat and a member of the team at EMA will assist you. And finally, I would just like to briefly go over to our agenda for the next hour and a half. Very shortly, I will pass the floor to Pirjo Spuul, the coordinator of the DTRIP4H project, and she will introduce the current framework and the ecosystem in which the project operates. After her presentation, we will have an intervention from Lars Münter, which will focus on key ethical principles for the implementation of DDTE. Then we will move into a moderated discussion segment with three of our panelists, Valentina, Grazia, Sapuppo, Ekaterina, Kutafina, and Dr. Gabriela, Onofre. Following our interventions from our panelists, we will invite members of the audience to have an open discussion with the panelists, and we will close the workshop with a summary of the conclusions and next steps. And so now, without further ado, I will pass the floor to Pirjo.
Yes, okay. So I am the coordinator of DTRIP4H project that has a long name, as you see, enabling decentralized digital twin era in existing research infrastructures for predictive, preventive, personalized, and participatory health. And I'm from Estonia, Tallinn University of Technology. So why this project was called to life was that there are several different needs or the context in EU, but also in other parts of the world. The healthcare faces rising costs and the complex health challenges. So the chronic diseases, cancer, like the cases are rising. During research or during the investigation of all these complex health challenges, we produce a lot of data, and the research infrastructures are very important or critical part in that. However, they face fragmentation, unequal access, and data interoperability barriers. So here where the digital twins could come to help. So they can transform the research infrastructures by enabling predictive, personalized, and participatory health research. So our project started January 2025, so it has been lasted a little bit more than 1 year, and altogether it is 4 years, so 48 months. It's quite a big project. It has 26 partners, and the EU budget is 12 million. And this, on the right side, you can see how the consortium, what does it consist of? So TalTech, or Tallinn University of Technology, is the coordinator, and it has 10 universities and higher education institutions, 3 research institutes, 2 medical centers, 10 enterprises of varying sizes, and 1 non-profit association. And in addition, it includes 2 research infrastructures, IRENE and IATRIS. And in IATRIS, we have 2 nodes, one at the University of Helsinki and the other one in IPN in Portugal. So the project or the initiative is Decentralized Health Digital Twin Ecosystem, or DDTE, that is connecting the European research infrastructures for advanced health research and innovation. It's based on a federated approach, and the open source DDTE is aligned with the EU data strategy. We use real-world and also synthetic data across the research infrastructures for simulation, experimentation, and remote collaboration. And what is unique or very big plus in our project is that everything is demonstrated through 7 proof of concept use cases. 5 use cases were started in the beginning of the project, but 2 more use cases will be actually launched in the middle of the project, so next year, when the 3rd year starts. And we use both augmented reality and virtual reality-based virtual environments to actually advance the training and skills. So here I have the overall model of our platform or the project. So the Decentralized Health Digital Twin Environment, or DDTE, is the central platform uniting the research infrastructures. As I said, we had Beatrice and Irene nodes recruited from the beginning. Irene in Czech Republic and Beatrice in University of Helsinki in Finland, and also in Portugal in IPN. And they are connected through the federated services. So we create on-demand data anonymization and also synthetization. And what is very important part of the project is that it creates kind of this governance framework and playbook where it is written how new research infrastructures are recruited, what is the legal basis, ethical issues, and also one important part is the sustainability of the platform. So the business model and capacity building is also included in the playbook. And who are the potential users of our DDT or the platform? Of course, all the research infrastructures, universities, hospitals, large enterprises, and research and technology organizations. So as you see, there are a lot of stakeholders involved in the platform. And this DDT or the whole project uses different AI and digital technologies. Federated learning enables the privacy preserving, but also it uses generative AI for synthetic data generation and also augmented reality and virtual reality approaches. And our project supports the European research area and contributes to the sustainable developmental goals of Europe. Of course, we are adhering to all standards and frameworks, so to FAIR principles, GDPR, medical device regulations, AI Act, and trustworthy AI principles. During the time when the proposal was written, the European health data space was not there yet, but we are also taking this into consideration, and it's also important to align with that. And of course, we adhere to all the different standards. As I mentioned already, we launched 5 use cases in the beginning of the project. And here I kind of briefly mention what these use cases are, in which fields these use cases are doing. So first use case is a medical imaging environment based digital twins with the purpose of training and educating professionals and informing patients about the potential risks of exposure to electromagnetic fields during magnetic resonance imaging. So with the digital twins, safety can be improved, training enhanced, and the MRI procedures made safer for everyone involved. The use case 2 is a virtual reality drug combiner that virtually assesses the combination of drugs and identifies those with a high potential efficacy and acceptable toxicity. And with the digital twins, we can explore a vast range of treatment possibilities and also reduce the animal testing or accelerate discovery and open new opportunities for rare disease therapies. Then use case 3 is assessment of inhalation exposure in urban areas. It's using available data to construct different AI and machine learning models of air quality, and this will lead to a significant improvement in exposure estimates for use in cohort studies and urban planning. And we believe that this approach provides city planners and policymakers with better decision-making tools. Then the use case 4 is a digital twin-based artificial tumor niches with tunable biophysical properties. And it develops a digital twin-based mathematical model of cancer niche geometry and biomechanical properties accurately describing the 2D and 3D cellular constituents of the cancer system. Use case 5 develops a precision treatment for schizophrenia using a digital twin environment to enable novel biomarker discovery and treatment outcome predictions. And here the digital twins model drug effects and support the design of personalized treatment strategies. So with all the project, we are creating, and what are the results? So we are creating the Decentralized Health Digital Twin Environment, or the DDTE. And we are also, this provides a novel approach for exploring data, assets, models, and also synthetic data generation pipeline. And importantly, it creates this governance framework and playbook, where also we give recommendations, guidelines, and best practices. And we have seven novel use cases where we actually, or proof of concept use cases where we demonstrate then our platform. I would end up the short introduction with all the places where you can find information about our project. So we have our website and our newsletters where we have updates or important news every 6 months. You can follow us in LinkedIn or X, and we have the website DTRIP4H.eu. So this picture is from our kickoff meeting where all the partners gathered in Tallinn, and on the map you can see all the countries involved in the project. So thank you very much, and if you have any questions, I'm happy to answer.
Thank you so much, Pirjo, for the comprehensive presentation. At this time, I would like to invite our first panelist, Lars Münter, to join the discussion. Lars is the International Director of the Nordic Wellbeing Academy, which is a non-profit organization which aims to contribute to the transformation and implementation of ideas and policies for future well-being across Europe. He also serves as the chair of the Public Health Communication and Trust Working Group at the World Health Organization's Regional Office for Europe, and he is a member of the Strategic Partners Initiative for Data and Digital Health at the World Health Organization. Lars, welcome, and thank you for making the time to be here.
Thank you, and thank you for inviting me. As the short introduction probably showed, my background is not data science, and nor necessarily should it be. And of course, with a lot of the wonderful people in this room, nor are your background data science. But of course, we need to explore elements of data science and data ethics in order to figure out our joint future in terms of both technology, in terms of the actual health services, in terms of our construction of society, indeed democracy itself. So while you may have not have started out being a passionate data scientist, you have to grow a small data scientist inside you. It doesn't have to be a digital twin, but it's actually one that, of course, has to carry some of these issues with you. In this particular case, one of the elements is that, well, there's a wonderful good news in the digital twinning element. Finally, we have a version of you that we're able to use so we don't have to bother you all the time when we are trying to do stuff. Bad news, we now have a digital twin that we can ask without bothering you. Hence, we do not know how that really affects you. The impact that it has, and sometimes either in terms of the amount that we bother you, in terms of your opinion when we bother you, All of those are extra elements that the digital twin cannot necessarily answer, because the digital twin is, of course, only an echo of you. For those of you that with a fondness still of Harry Potter, this is not like a Horcrux, actually, but it is still only an echo. It is not a full representation. So that would be the first sort of really issue here. It's a representation. It is incomplete. It doesn't have, to the extent that you were able to really share the full version of you, it would at best only be the objective version of you or the official version of you. Would you share your dirty secret or dirty laundry or whatever to your digital twin as well? Most people would not. And they are, of course, also part of the element that makes you you and will make the digital twin incomplete. The echo that can do a lot, but not provide the full picture. So that is one, of course, that really sort of carries a bias onto itself. We leave behind, not necessarily in this case, an Instagram version of us, but one that is curated for sort of a decent representation of yourself. Then comes, of course, sometimes the element of really of consent. Well, you consented to sharing the digital twin, but if you were you would maybe be really like to be asked questions about whether you wanted so and so. You would have an opinion. There would be a difference between whether you wanted to go through door number A or door number B. Your digital twin will likely say yes to every request, well, where you would not. And the yes and the no would actually carry value in a research context. Is this something that a real human being would actually consent to? The digital twin would not be able to provide that answer. And then, of course, the element sometimes, of course, of continued representation. You would, over time, maybe change your opinion about what you consider to be a quality of life, what you would consider to be maybe a dignified treatment. Your digital twin might not actually change its opinion because it doesn't carry the sort of the baggage, the extra heavy weight of what you have experienced. Because of course, and to some extent, when you create the digital twin, it becomes a representation of you in that moment. But you carry on living. You carry on living, getting children. You carry on living, getting a divorce, lose a spouse, all of those elements that actually makes a difference to some of those elements. So of course, when you do a snapshot of the digital twin, you have that snapshot, but also again, only a representation of you and not the full concept. So while of course the digital twin can do other stuff, how can we update? That's a question for this group as well. How can we update and make sure that the digital twin does not appear? I mean, my Lars, 20 years old, is not the same as Lars, 30 years old, nor 40. And I would guess for most of you, that would hold true for you too. So the digital twin, which digital twin? Which of me are we talking about? And at which stage? And then, of course, in this context, we're doing the digital twins because we want, as a system, to do something about something else, providing better clinical treatments, maybe. We want to build other elements. But we cannot, again, ask the digital twin, once we've done whatever we did, whether they felt like it was a good idea or not. And that's, of course, a decision-making problem. We have something that provides us maybe with a potential what, but not a potential why, and not necessarily an exclamation mark. So 4 elements, it's only a representation. It cannot give consent in every form. You have an element about lag, control access. Who are we? What digital twin? Which of my digital twins are we talking about? And then, of course, the element of how do we actually truly make a decision based on what we found from the digital twin and move forward. So
Thank you so much, Lars. I think these were very interesting points, and I think it covers a lot of the potential ethical questions that that we want to gain a better understanding of in order to move forward with the project. So that was very interesting, and I think provides a really interesting foundation for this discussion. And if I can ask you a follow-up question there. So yeah, we talked a little bit about the ethical principles and the aspect of continuous informed consent. What kind of transparency mechanisms do you think that could be put in place with such an infrastructure and environment that could help to enhance trust with the users and the individuals whose data would essentially be used?
Well, I suppose one answer to that question would be that it is indeed transparent in the sense that when we are asking the digital twins, let's, in a sort of metaphorical sense, think that we are joining a sandbox of digital twins and we're thinking of asking them questions. Surely we can invite their digital, or sorry, their analog counterparts to also join the room to see what we're asking the digital twins as well. And of course, sometimes what I'm suggesting here, it doesn't make sense because in a digital world, we would be asking the digital twin simply a question via a large language model or something similar. But let's think about how we might be able to do that so that we can construct something similar like a focus group, for instance, so that our users, the analog can see the process. What's actually the thing that we are hoping to get from your digital twin? The whole point of doing the digital twin would of course be to avoid consistently sort of annoying or having to drag the analog into the mix, but let's allow them to still peek inside the wizard's workshop. So that's one element of the transparency. The other element of the transparency is, of course, to think about that you can never get too much of it. There's a profound difference here. Truly, yes, governance is an element of trust, but governance is actually an ossification of it. It is not trust in itself. Sometimes governance can even be the opposite of trust, because if you do not allow the ones that are governed to be part of the table, they feel oppressed, they feel excluded, they do not feel trusted. So in this case, of course, while governance and ethical sort of approvals, legislation can make sure that the ones that would be providing the trust, providing their digital twin with the will to allow us to play with their digital twin, they need to also peek inside the wizard's workshop. They need to be part of the table. They need to continuously be informed about what happens. You cannot then say, fine, you signed a consent form, and of course, we also know, but with GDPR, that doesn't make sense. But still, there is no sort of end goal in saying, you signed the form. What's wrong with you? This is a continuous system, a continuous relation. And maybe think of it a little bit like a marriage. Just because you said yes once doesn't mean that you actually can do whatever you want later on. You have to think of it as a dynamic relation with that other, well, in this case, spouse. And as you know, most of you, even though your partner said something yesterday, it might not mean the same today. And you should take care, of course, of continuously checking in with that relation, because that is what it is, a relation. So that's some of the elements about the transparency as well.
Thank you. Yeah, I think that makes a lot of sense and also covers another question that I was going to ask you, which is what aspects would undermine that trust, and certainly ensuring that the development is a co-creative process and that the right people, the people involved and that are affected are invited to the table is definitely a way to ensure that that trust isn't undermined. So I think that's a really interesting point. Thank you. Is there any other aspect or way, methodology that you think accountability could be demonstrated? So we talked about, the transparency and the accountability goes hand in hand.
Oh, yes, that there is actually the relation between accountability and transparency is quite clear, of course. But their element, of course, about joint purpose. There is, I am a blood donor. I'm still a blood donor. I've been a blood donor for almost 40 years. Um, if I figured out that someone used my blood for commercial purposes, I would, of course, that I didn't originally consent to, I would be offended. But if I figured out that they've never actually, in those 40 years, used my blood for anything, I would be even more offending. But I mean, that would have been a complete waste of my time. So in this element, of course, there's a limit to how much we can use the digital twin for commercial purposes. Has to be a joint purpose of a common good. That's one. But also, there's an assumption that when we do things, that it's actually used. So if we bury the entire thing in a lot of overly cumbersome challenges of ethics, of legislation, and so on, so that nothing really comes of it, that would be even more offensive, because we would be really truly wasting their time. They assume from what they are doing, what they are providing, what they are donating, that we'll be using it for something good, that is beyond money. Yes, but it's as long as we provide an account for what we actually did to provide that common good, treatment, people cured, some kind of add-on to society, then we're good to go. If the only thing that we provided in our account would be profits to, I don't know, I hesitate at this point to mention any particular country, but if all we did was to provide extra profits to some company, then of course that was not what they originally consented to. But let's not kid ourselves that they want us, they demand of us that we use it.
Yeah, that I think that makes a lot of sense. And going back to your point about the common good, I'd just like to close with one last question. How do you think, in your opinion, political momentum for such a digital twin infrastructure can be built and sustained to ensure that not only that it's adopted in a widespread manner, but that it can have that maximum positive impact on society?
Well, I would think that the political will to make sure that we build a digital twin that would, and it's a Faustian question, really, because of course, wouldn't you want maybe finally to get this digital twin so we can get rid of all those annoying ethical considerations with the citizens? And then also sort of completely overlooking the fact that the ethical is in sort of interaction with the citizens were really the ones that really provided the value, not per se actually the digital twin itself. Yes, we want the clinical results, but without the other elements, the democratic element, the consent, the discussions, how would you really know that it provides quality of life? That is something that the digital twin will never really truly be able to answer. So that's the one of them. That's beware of the Faustian question here. The other one is, of course, that doing what for what? Is it just to provide a better healthcare, or is it to provide better health? So the question here is, of course, that I've used the analogy also in a discussion, I think last year or the year before with the European Patients Forum, where I said a little bit provocatively that I would be looking forward to the day when an AI would be taking decisions about my health, because finally it would be done by an objective measure. And then, of course, you had a knee-jerk reaction in the room saying, but what about the bias that the AI has? Well, have you ever thought about the bias that humans have? We have a lot of bias. And one of them being the assumption that what we use it for. So in the context either of the digital twin or the AI, the machine learning, the whatever we're doing, if we're using it to optimize the amount of knee surgeries by 100%, we're using it wrong. Clearly, the element here was to use the AI, the digital twins, to reduce the need of knee surgeries by 100%. So the preventative side not the optimization of more treatments would be sort of a true element. So when you're asking the digital twin, when we're using and exploring, how can we use it not just to provide more efficiency in the clinical system, but truly sort of improve our society? And sometimes, of course, ask tough questions about things that are truly health determinants. But where we provide the canary in the coal mine that figures out that either the way that we construct our cities, the way that we construct our energy systems, the way that we construct our transport system are inherently wrong and needs to be transformed because we are treating too many cases in the healthcare system that someone else has dumped on us, if you will. So that's the element. Yes, let's move forward. There's a strong political momentum, I would say, but let's take care about what the true question we're asking the digital system really is.
Thank you so much, Lars. And I think that really gets to the heart of the project and, really what we're aiming to do and really trying to work towards better health. And it's important to ensure that that's not forgotten with, there are so many other elements and so many technical aspects that, that aspect really is at the heart of it. So thank you again so much for joining and for providing your intervention. I know you had you have a lot of things going on at the moment, so I really appreciate your time, and you're welcome to stay for the rest of the workshop if you're able. And I hope maybe if there during the open discussion segment at the end that you may be able to respond if you have time. Thank you so much. So at this time, I will move into a moderated discussion with some of our other panelists, who I will introduce one by one. So first, I would like to welcome Valentina Grazia Sapuppo, who is an Italian lawyer and a technical advisor who specializes in AI governance, data protection, and cybersecurity. She serves as a legal and technical expert for UNINFO and Senelec JTC 21 working groups on AI standardization, and she's also a member of EDPB's support pool of experts. She is a qualified lead auditor for ISO standards on AI management systems and information security management, and has professional experience in regulatory compliance frameworks for emerging technologies. Her professional background includes roles as a technical officer at Ekaterina, the Italian national accreditation body, and as a certification scheme manager at a notified body. We are also joined here today by Ekaterina Kutafina, who serves as research lead for data-driven medicine at the Institute for Biomedical Informatics at Cologne University Hospital in Germany. Her current role involves integrating different components of computational medicine projects' life cycles, which includes overseeing the data sharing process and clinical relevance of computational modeling. A few of her areas of expertise include medical data analysis, in silico simulation algorithms, fair data sharing and open science, and medical data infrastructures. She holds a PhD in applied mathematics from the AGH University of Science and Technology in Poland, as well as a PhD in theoretical medicine from the University Hospital RWTH in Aachen, Germany. And our final panelist is Dr. Gabriela Onofre, who is a medical doctor with over 20 years of experience in healthcare, including 15 years in research and laboratory medicine and 5 years in education management. She has extensive international experience and has worked in Latin America, Europe, and the United States. Her expertise includes the management and development of new drugs, as well as the intersection between education and social responsibility in healthcare. She is a member of the Simulation Conference in Lyon, as well as the Women in Science program in Dresden, Germany. She is the founder of the startup Prevention is Smart, which focuses on implementing artificial intelligence solutions in preventive healthcare, cancer, and chronic diseases with the aim of ensuring a real social impact. To all of our panelists, welcome and thank you for joining us today. I would like to start this discussion by asking you for your initial thoughts on the project presentation based on your professional backgrounds and expertise. And is there anyone in particular that would like to start? Valentina, would you like to start?
Of course. Thank you, Alexandra, and thank you all for inviting me in this very interesting workshop. The topics, ethic topics, and governance and regulatory issues are very, very, very important for digital twin development and infrastructure jointly in research in Europe. About these issues and topics, I think that in this context, the prior focus is on governance and compliance. Because regulatory compliance and governance are two phases of this of the same real and research infrastructure that will be participate in the federate structure of the research must be able to demonstrate a solid data processing framework compliant with the GDPR, the AI Act, the Data Governance Act. If the DDTE integrates AI components, in fact, each research infrastructure should also be able to assess whether those components fall under the AI Act's risk classification, in my opinion. It's not only a way to analyze this project in research fields because digital twin can realize multiple potential consequences on people and patients. And therefore, the governance playbook should set minimum entry requirements and progression pathways. And for the a governance approach, for example, voluntary standards like ISO IC 27001 and ISO IC 42001 can serve as maturity benchmarks without certification being compulsory. This is my opinion for the start of this fantastic discussion. Thank you, Alexandra.
Thank you very much, Valentina, and that gives me some ideas to follow up on within later questions. Ekaterina, would you like to add your initial thoughts?
Absolutely. Also, thank you so much for inviting me here. It's actually much more diversely represents group as I could have expected. I really appreciate that. So my interest is really applications in the clinic. So I have lots of thoughts regarding all sorts of aspects, but I think we need to really clearly distinguish well, I'm not sure how to call it, stages, modules, but it's going to be very, interconnected, because I believe that in the first step, the distributed infrastructure for digital twins needs to serve as a sort of a playground, research playground. So we're going beyond just developing models based on the openly available data. We are it's a huge step towards real implementation on the clinical data. However, we need to give a little bit of research freedom to explore the models and preliminary validate them, and then see how they can really be transferred in the clinics. And I believe that realistically, a lot of those models which would be developed in the distributed manner will be applied locally on the local data. I think this is the most viable, at least currently, direction, because I think with the huge diversity, I believe it would be really, really difficult to have real-time digital twin running really in the clinic in the distributed manner, which also kind of so on one hand, we need a little bit of research freedom, but on the other hand, it also does not make sense to spend time on developing models which are not clinically viable, which means that indeed we need to consider this potential for translation in terms of regulatory parts, and also in terms of fitting in the actual clinical flow or whatever other healthcare flow at the early stages. So this vision should be from the beginning, and there should be clear guidance how not to waste time and develop things which have this clinical potential, but in the same time, we don't need to fix completely everything from the beginning. On the other hand, if we are even developing the research models, of course, it's already human data involved. So all the regulations in regard to research immediately apply. And that's very challenging also, particularly because of this multi-country interpretations and so on. And also one more point, of course, there are regulatory official points like GDPR, like AI Act, but there are also best practices, because sometimes those regulatory kind of official guidelines, they're very unspecific, particularly if it comes to AI as medical device. It's still very difficult to really understand what is the requirement, how we validate the AI models. And there is a lot of development in this direction. And I think it's really important to follow here also best practices from research, from modeling, in silico modeling, have very nice guidelines in this regard. That's also important part. Future AI, for example, construction. Thank you.
Thank you for that introduction. I think that that you posed a lot of good points that we can consider. I'm just double checking with our other panelists. Gabriela, can you hear me? Would you like to add a few points, Gabriela? I think she's been having a few technical difficulties today, so I will just move on to the next question, and hopefully
hello?
we can. Oh, yes, hello.
Sorry, I had a problem with my phone and my microphone. Please, thank you so much for the invitation. For me, it's an honor like be here and be a panelist. I am very glad that I can share my experience, and also I am happy that my colleagues was before than me, because it was really nice listen to them. For me, this is important topic because I think we want to improve the knowledge, and we want to share our experience. DDT is not just a technical project. It's fundamental about the trust, governance, transparency, usability in healthcare. As medical doctor, researcher, and educator, I can confirm it. And for me, it's important that the implementation of technology, we can implement AI, AR, VR, we can implement tools for improve the knowledge and the shared knowledge between doctors, patients, healthcare education. We can have some challenges for the future, but what we need to make the difference is the governance and the first approach. And the second is we begin, begin develop the trust, the mapping, the existing policies, the standards, the operation procedures, the co-creation with stakeholders, including with the researchers, with the educators, with the people that want to work with us, the legal problems, the technical and the ethical points, also the business dimension. All is important because it's a new technology that we can use in our future. Now, with the development of how we improve or how we need to manage and support these tools in clinical work flows, it's important the integration. It's important the put health education in the system of the hospitals. The records, the electronic health records, the imagining platform. We need to improve this platform and without requiring duplications of effort. We need to do this simple. The relevance about this is also for the clinicians and for the educators, and for sure, the most important is implement and provide scenarios that can improve the support the decision making and in real time. We want to improve the dynamics and the models. We want to support these ideas, and we need to avoid bias in AI models. We need to identify the access that we will have. We need to have the first scientific validations, governance, data security, privacy, interoperation. For me, this is really an important topic because we want to collaborate with ethical and moral parameters, security digital, health ecosystem. We want to put real values to the clinicians, they protect patients, earn the trust, improve the education, and all these things.
Thank you very much, Gabriela. I'm sorry. Thank you very much, Gabriela, for that response. I think that was very interesting, and it also touches on one particular aspect that, of course, we want to take into account regarding the development of this environment, and that's making sure that this can be a meaningful support tool for clinicians. And you brought up a really good point, a few really good points to ensure that it's not just, an additional burden for them. It's actually something that can help and avoid, the duplication of efforts and aspects like that. So thank you so much for touching on a few of those aspects. I have a follow-up question for Ekaterina regarding this. What aspects do you believe would need to be in place in terms of data integration and infrastructure to ensure that DDTE would actually be usable and helpful in practice?
That's a common struggle. I would say, without getting into a lot of tiny details of those struggles, one of the primary point for my daily life is integration of research data, basic research, and the clinical data, because they live in completely different environments. And for example, during the EDIT project on digital twin, there was those very nice ISO norms developed for data, which kind of covers a lot of research data. But for example, in Germany, we have medical informatics initiative, and clinical data for secondary use is normalized to HL7 FHIR standards. And even if the standards look like they're the same, depending on which bubble we are talking about, the content of this data could be extremely different. So I believe that technical aspect of decentralized computations, it's of course not an easy task, but it's more or less straightforward how it should go. However, the data harmonization, of course, let alone the legal issues, but data harmonization, it's a huge deal. And on the other hand, I'm quite optimistic because it seems like clusters are kind of internally harmonizing, and then those clusters are going to build more and more connectors. So, for example, Faris Connect has some translations to OMAP. It's not working perfectly, but it's slowly building up. So I'm quite optimistic, but it's nevertheless, it always needs to be considered in terms of how time-consuming it is. And it never should be assumed that the data looks like it's the same. It's never going to be this way in practice. Right.
Thank you for sharing your thoughts on that. That's definitely really interesting. And Valentina, I'd like to turn to you now to kind of focus a bit more moving from the technical side to more of the regulatory and compliance side. I know that you mentioned a few aspects in your introduction of how to ensure that that the DDTE complies with frameworks such as GDPR and the AI Act. And I was just wondering if there was anything else you wanted to expand upon in that regard, since that is, an expertise of yours. I'd be happy to hear your thoughts.
Thank you, Alexandra. As mentioned before, compliance must be embedded in all projects that involves on health space and health data. And for DDTE, compliance must be headed in the design of the project. In GDPR, we know the principle of privacy by design and by default as required by Article 25 of the GDPR. And I see three critical issues that deserve our workshop and panel attentions and colleagues. The first pertains to the boundary between synthetic data and personal data. Because the digital twin produces synthetic data from real patient data. And in Italy, we study for very long time the many possibilities of the secondary use of health data and biological health data from many persons that analyze it in hospital. The question is whether this synthetic data is genuinely anonymous with the meaning of the recital 26 of the GDPR. Because if the generative model has been trained on real data, the risk, as I said before, of the model memorization could allow information traceable to specific individuals to be extracted. And in such cases, this synthetic data would remain personal data in every aspect. And one mitigation, for example, mitigation technique is a differential privacy. And the second risk that involves on this context and re-identification from external sources. Absolutely, in these times, agentic AI are very, very, very hard techniques that can put persons and fundamental rights of people, all people, in a context that is not guaranteed. And the third concern involves bias that colleagues said before, hallucination and risk on fundamental rights. Digital twin is a real fantastic disclosure for research. Like technique that can assure the possibility of researchers to improve techniques, medical techniques on disease progression, makes prediction. But if these predictions are inaccurate, the consequences are directly impact on the individual and the natural person, and many risks we can pointed about digital twin and data, health data that can remain local or federated. Who is the real organization that is accountable about treatment and application of technical research.
Thank you so much for outlining those aspects. It's definitely going to be that's one aspect that we're really focusing on, especially in the governance playbook, is the compliance to these legal frameworks. So I think that provides us with a really good points to bear in mind. Ekaterina, do you have any points to add on to Valentina's intervention? Ekaterina, would you like to add any insights?
Maybe the internet is wrong, I guess.
I think so. Okay, that's okay. Well, Gabriela, I will actually come back to you for the next question. We touched a bit in during Lars' intervention about ensuring informed consent and patient autonomy, and I was wondering, with your experience as a medical professional, what your thoughts are on this, and how we can ensure that these aspects are respected.
Thank you so much. This is really a very important point because, like medical doctor, we need to know that the confidentiality, the ethical parameters are really important, and the trust that we will have with our patients. For sure, that is traditional consent models, but is not sometimes sufficient for the DTE. Also, that we need to see all the parameters and all the rules that are in the hospitals because it's a little different when you prepare this for the research and the clinical trials, or like you prepare for other kind of research that the children, we need to have some parameters that the patients need to give the permission that maybe sometimes that we will use the AI. Now is we try to harmonize the data, and we don't will have that the names of the patients. We can avoid it with anonymization, pseudo anonymizations. We need to implement all the technology in our areas that with legal and ethical parameters. For us, the most important is the privacy of the patients, that the data use need to be clear, transparent. We need to inform the patients what we will do, that the training, that the research, if it's clean trial, that what we will want to have, the aspects at the clinical, the clear explanations need to be really very precise that in our projects need to be explaining, and the institutions need to have the guidelines. We need to pass the ethical committees, and we need to avoid the errors, the bias of the models, incorrect simulations or like the systems. We need to work with a multidisciplinary team, and this multidisciplinary team with ITs, healthcare professionals, and patients need to have all prepare for the technology at the cyber security, and co-work with the cyber insurance, and we will do all the best for the patients. We need to be a strong GDPR compliance protections, and I think that is our goal, implement and put all these new technologies with the legal harmonization for Europe, and use the clear definitions and the clear explanations, integrate the insurance and the governance with all these parameters about the risk that we can have. The most important all the time is the patients, the trust in the institutions, and I think that this is the most important for us. Thank you so much.
Thank you so much for outlining those aspects, Gabriela. Ekaterina, I see that you, I think you were able to join again. Did you have
Yes,
something that you wanted to
crash
add
for a
to?
moment. And actually, it was still I wanted to add to what Valentina mentioned, because she was talking about the synthetic data, which is a super important point. And I think one thing which is really important to consider is that now with popularity of AI models, we forget that there are also other models out there, and it's all kind of becoming one big pile, while they are the models can be conceptually very different. So, for example, in terms of synthetic data, it's also very important to consider how the data is synthesized, because generative AI is one thing, and the synthesized data, which is based on the knowledge-driven model, is a completely different thing. So I think it's very important to have this clear communication between legal experts, also persons who are responsible for legislations and interpretations, to clarify those differences. It, of course, becomes even more complex when you start mixing data-driven with knowledge-driven models, but it's really huge differences between those computational approaches, and they need to be considered. However, of course, synthetic data is definitely a point of consideration, because it is often being used without any legal basis, and it should be carefully considered.
Thank you for outlining that, and for building on the points that Valentina had brought forward. And Valentina, I'd like to go back to you as well, talking a bit more about the technical capabilities, and I wanted to pose to you what technical capabilities do you believe would be required to join DDTE?
Thank you, Alexandra. As I said, in the DDTE are integrated AI components, and technical capabilities are important, but governance is the prior focus, because technical environment and capabilities are a consequence. In my opinion, the most complex constraint in a DDTE project is the chain of responsibility. And because the GDPR distinguishes between controller, joint controllers, and processors, and if we not identify the role of many actors in the DTTE project, we cannot decide the technical features and issues. And in a federated architecture, where data remains in place, but the models moves, role qualification is not straightforward. If multiple research infrastructure jointly train a federated model, determining together the purpose and means of processing, and this constitutes joint controllership requiring and transparent agreement under Article 26 of the GDPR. And technical decisions. Meanwhile, for not focus on only on GDPR obligations, the AI Act distinguishes provider from deployer obligation. And in a research project, these roles overlap, and the same partner may simultaneously be data provider, model developer, and deployer. And one further point, if the digital twin process, or generate biometric data, these fall within special categories under the application of the Article 9 of the GDPR and other obligation. And I hope my answer and this other point of view about your question is appreciated, because technical safeguards are essential for trust, for accountability, but all of these are consequences, choices about governance, playbook, role, activities, treatment, and many techniques, AI application or not, a fragmentation of role and capabilities, technical and governance capability.
Thank you so much, Valentina. And that really brought up a very good point, that, you know, the importance of establishing the roles in order to better understand the technical aspects. And that is something that we aim to do with the governance playbook. It's something that that the project work package that we're involved in, that's going to develop this, is working on. So that just kind of brought it home a bit more. So thank you for highlighting that and for bringing up those very interesting points. At this time, I would actually like to open up questions from the audience to see if anyone has anything they would like to pose to the panelists. I know there's been a very interesting discussion going on in the chat, but I will just, before I ask our panelists any more questions, I'd just like to see if there's anything that anyone would like to ask at this time. You can feel free to raise your hand, or you can use the chat, whatever you're most comfortable with. Yes, Fulvio, I see you have your hand raised.
Yes, thank you. I'm president of an association called the Stati Generali dell'Innovazione in Rome, Italy. By the way, Valentina is our very nice associate. And we are dealing substantially with all these kind of things, including digital transformation, ethics, AI, geoinformation, satellites, and so forth. This is one of the things that we are dealing right now. We have just finished a couple of days ago five events and webinars on the arguments of the e-health in general for rare disease, use of technologies on this in the framework of the All Digital Weeks, which are 3 weeks of digital competence yearly. by an organization, pan-European, an organization based in Brussels, which we are associated to. Just to present ourselves why we are here, I was invited by Valentina. I think it's a very interesting project. I just would like to make some few more comments about our field of expertise. First, has been said, and I totally share the fact that this digital twin run the risk of being frozen for the beginning. And when the Lars, I think it was talking about divorce of other things like this, of course, this should be taken care by the digital twin. But this is a dynamic. For those of you who are experts, and they know that the digital twin process is really dynamic process. So it's continually adapting. So I would be not so much worried about the staticity of the digital twin because it's inherently dynamic. I would be much more worried, and has been said, but not with the needed strength about the biases. This is the real issue because, of course, we are biased, and we know that all the AI things and the social are biased. So if we change the model with synthetic data, we update everything, but there's still any kind of bias. This remains. This is, to me, is the issue more important from the ethical point of view. I understand that the ethics is one of the guidelines of your project. So I would be much more, let's say, pay attention on this. And I just would like to underline as a last reminder that probably this is the concept of the so-called human in the loop that should be really very in rather than on. You know the difference. I mean, the machine decides, and I just supervise on the loop, but I have to be in the loop. So the humans must really control what the algorithms are doing. And this is, again, one of the things that is very important to take into account for the ethical point of view. And last but not least, this is exactly, for your information, if you are not expert in telecommunication, I have no idea what is the background. So I'm sorry, maybe I'm telling something which is obvious to everybody, but the 6G, which is now under development as a follow-up to 5G, is doing exactly this. It's putting together a sensing environment for doing holograms, digital twins, or everything. And I like the 5 use cases that have been illustrated. This is exactly what they address. And they use AI and cognitive computing to self-adapt to the changing environment with a very little latency and delay, which allow to do very, very nice things about health, about, assistance to the elderly people. Maybe they have falling at home and so forth. So I would say that all these kind of things concerning ethics must be really taken into account with substantially attention to the adaptability of the digital twin versus time, bias control, and really human in the loop, sorry. Thank you.
Thank you so much, Fulvio, for those very interesting points, and I'm sure that we're going to keep them in mind going forward. For the sake of time, I'd just like to address one last question from the chat. Dominique has posed a question. It's how can we implement standards that consider the human being in their entirety, physical, mental, energetic, and environmental, while preserving robust data protection? And all this with deontology and ethics in practice, given that the data will be dematerialized. Is there any panelists that would like to address this question?
If I can, Alexandra?
Of course.
Thank you. Thank you for the question, Dominique. In European Union and the AI Act regulation are set many rules that demand to select standards that are very structured standards, technical and ethical standards that put requirements for the develop and control of AI application for all the AI life cycle of the AI techniques and AI application systems, AI system application. This for the first input, and I'm glad to pass the possibility to respond other colleagues in room because time is running out. Grazie. Thank you, Alexandra.
Thank you very much. Would either of the other panelists like to address this question?
Excuse me, I can add that, like medical doctor, that for the physical standards or like the clinicians, that is very important, the validation of the physiological models, depend if you will do something related like this. Also the compliance with medical devices, that is important. And I am agree with Valentina that all the rules that we need to do, like the legal and all the things that technical, like a medical doctor, I can add that in the mental area that we need to be really clear, and we need to put the points that we want to cover and avoid, because mental health care is really big topic, and the protocols need to be really clear. And also, if we work with patients, or if we work with children, because it's different. Avoid the information over life for the clinicians, that is important. The support, because sometimes we can give medical support or like psychological support and use these new technologies for the patients. For sure, all the explanations was nice, and we need to, in the environmental, put equality with the accessibility across with the regions and populations. Sometimes we do some preventions programs, or like we can use like in the reproducibility for health. Public health, also for some demographic projects. All depend of the projects that we will do. Thank you so much.
Thank you very much for responding, Gabriela. For the sake of time, I would like to pose one final question to our panelists, and that is if you could give a brief, 1 minute summary or of key takeaways from this meeting, and what if you could give one final thought. I would be very interested to hear it. Ekaterina, would you like to start?
Yes, thank you. Well, I suppose it's always important to chunk the complete picture into modules. So we need to definitely separately discuss the data interoperability and technical aspects, and the legal backgrounds, but not there is not so that it's a complex landscape, I would say. So we need to see which parts of the digital twin environment, what corresponds to which legislations, right? Because it's not a single homogeneous thing. So, for example, for the research data processing, GDPR immediately applies, while the medical device regulation, for example, may apply in the future, but we need to consider it already from the start. So it's very important to see which parts of this legal aspects apply. But I think it's indeed one of the most critical points to address. And like I mentioned before, the distinction between different types of modeling and clear distinction between AI and the knowledge driven is crucial. And the communication also with the lay audience is absolutely essential to make it maybe more clear what exactly digital twins are and what they are not.
Thank you very much, Ekaterina. Valentina, would you like to give your key takeaways?
Yes, of course. Thank you, Alexandra. My takeaways are about 3 point of view and issues. The first, know the difference between what you must do and what you should do. GDPR, AI Act, and here about are regulation, mandatory regulation, and standards like ISO ISC 27001 or ISO IC 42001 are voluntary management standards for management system that can help this project to demonstrate responsible practice and to the way to put on policies and procedures. And the second, the centralizing data does not decentralize accountability. In a federated architecture, in my opinion, for all regulation and best practice that we know, the temptation is to assume that keeping data local solves your compliance problem, but it is not. It does not. And we still need to clear rules, and these rules must be documented and auditable across every node and focus point of the structure of the federated organization. And third, start governance first of all, and not technical architecture. The most common mistake I see in my experience in all projects and yield that a project is treating regulatory compliance as a final checkpoint, like data protection compliance. This is a problem. This is a problem because move by default is a fundamental choice for best governance in the future of all cycle of the life cycle of the project, and compliance is very runway to move on all project that we can develop now and in the future. Thank you, Alexandra.
Thank you very much, Valentina. Gabriela, we were just discussing our key takeaways. If there is anything that you would like to add, we'd be happy to hear your thoughts.
No, only thank you so much for the invitation. The second, for me, the most important is that our colleagues can learn about the experience. We can share the knowledge. We can try to see if we can co-work together. Will be nice if we can share the networking together, because for sure that we want to implement these new technologies in our projects. And for me, is a new opportunity for open discussion. I hope that you will repeat these kind of initiatives, and we can share more knowledge and grow together.
Thank you so much, Gabriela. That concludes our workshop today. I'd like to thank each of our panelists for sharing their expertise with us today, and all of the participants that have joined us. Your insights will contribute to the development of the governance framework, as we mentioned, but also to the development of the digital twin environment. If you're interested in being involved in future events, you're welcome to join our stakeholder group. I will put the link in the chat. to an article on the DTRIP4H website, and there is a link that you can follow to indicate your interest. So if you join our stakeholder group, you'll be kept up to date regarding upcoming opportunities to participate in the project, and you'll also have the opportunity to gain early insights and valuable takeaways from co-creation activities. Our next workshop will take place on April 23rd, 2026 at 10 to 11:30 CET. This workshop will focus on data request and access scenarios to simulate cross-research infrastructure access, identify policy misalignment, and discuss security expectations. So we'll have more information available regarding that soon. And I see, Pirjo, you have your hand raised. So would you like to say something?
I'd like to thank everybody, all the panelists and people here. It was really valuable session. And I think we got really good feedback and input for our project. And I really hope you can also join the next workshop, because I see that this format is really productive and good. So, and many thanks to Alexandra for mediating this interesting session. So thanks a lot.
Thank you so much. I'm just going to share my screen quickly just so you can see. If you're interested in following the project and learning more about what we're doing and our results, you can visit our website, or we're also present on X or LinkedIn. So feel free to join us there. But with that, I would like to wish you all a great rest of your day, and thank you so much again for joining and participating.
Thank you.
Thank
you.
you.
See you next time.
See you.
Thank you. Thank you very
Bye.
much.
Bye.
Bye.